Also today, we're marking 4 years since the first case of COVID-19 was detected in Kentucky. It happened in Harrison County, and now 4 years later, the pandemic is over, and we have tools to help fight new infections. But some old infections are still causing medical problems. Jim Stratman explains.
We are bringing you in-depth coverage, answering the facts you need to know about coronavirus now in Kentucky, our first confirmed case.
4 years ago, we were in the dark.
The state's first patient is in isolation right now at the UK Medical Center in Lexington.
A brand new disease wreaking havoc, causing deaths, leading to a mad dash for answers.
Because this was novel in 2020. That meant it was very new, and it's still very novel.
And complications from that novel virus continue.
As we're looking at these long-haul COVID symptoms, that's what we're treating them as, symptoms. We don't know what the cause of this is just yet.
Dr. Mona Lisa Taylor is a primary care doctor with Norton Healthcare. She says that long COVID can develop after an initial infection.
The COVID-19 virus tends to stay in our tissues, and that might be the brain cells, the gut cells, the heart cells, the lung cells. It's just hanging out. It can also cause your immune system to basically flare up any time it perceives a threat. Your immune system goes above and beyond to try to fight this off because it thinks it's COVID again.
This can lead to a wide range of symptoms like issues with breathing, loss of taste or smell, daily headaches or migraines, even things like diabetes, prediabetes, or developing blood clots. One that Brittany McAndrew sees often is brain fog.
Patients are reporting difficulty with attention, dual tasking, processing information, maintaining train of thought in a conversation, remembering what I was getting ready to say. Also things with memory and executive function skills, which is our ability to plan and organize more higher level cognitive processes.
McAndrew is a speech-language pathologist with Norton.
We've seen patients initially up to a couple of months or weeks after COVID, and then now we're seeing them who've had COVID 3 years ago or so.
She and her team developed long COVID therapy from scratch after the pandemic started, with the goal of helping people who suffer from long COVID brain fog.
We teach patients attention strategies, memory strategies. We then use exercises to help practice using the strategies effectively. Not everybody returns to what they knew as normal, but a lot of patients can regain the skills and the functions to return to a normal lifestyle.
Both McAndrew and Dr. Taylor agree. 4 years on from that first case, there is still a lot of unknowns. At this point, the focus is on treating the symptoms, doing the research, and hoping for more answers in the next 4 years. In Louisville, Jim Stratman, WHAS 11, on your side.
Both McAndrew and Dr. Taylor say the sooner you catch and treat COVID-19, the better your chances of not developing long COVID. They suggest testing on your 3rd day of symptoms and contact your doctor if you test positive or have any concerns.